Welcome, ladies and gentlemen, to today's program, where we're going to be going and discussing one of the most important healthcare programs in the United States. That's Medicare. In the next 10 to 15 minutes, we will dive deep into Medicare, who it covers, how it works, and some of the recent developments. So let's begin. First and foremost, we need to break down what is Medicare. Medicare comes in three parts. First and foremost, you have Original Medicare. Original Medicare is going to be Part A and Part B. Now, Part A is your hospital insurance. This covers your inpatient hospital care, skilled nursing facilities, hospice, and some home health care services. Now, as long as you've worked a minimum of 10 years and you've paid in all of your FICA tax. The way this works is 95% of that goes towards your Social Security check. The other 5% goes towards buying you Part A. Most people own Part A already. They've bought and paid for it. Then there's Part B. Part B is your medical insurance. Part B helps cover doctor's visits, outpatient hospital care, preventative services like screenings, vaccines, and durable medical equipment. Now, there is a price for this. That price starts at $164.9 a month. Now, the reason I say starts is because that can go up if you make a lot of money, and that can go down if you don't make a lot of money. So this is why I say it starts there. Now, that is all Original Medicare covers. Original Medicare, if you follow it, Part A has deductibles, it has copays. Part B also has deductibles and has copays. So on average, Part A and B is going to cover approximately 80% of the bill, leaving 20% of the bill on you. Now that is all A and B cover. That is what they put in place back in the early 60s when Medicare was first introduced to the general public. Since then, healthcare has changed a lot, and so hasn't Medicare. This is why they came up with an option 1 or option 2. Option 1, this is going to be your Medicare supplement insurance, also known as your MedSups. These plans, by law, all do the exact same thing. They cover that 20% and all of the deductibles that Original Medicare leaves on the table. That is it. Then there is also a Part D plan standalone. This is for all of your prescription drugs. That is option 1. This is a 3-card system. You would have 1 card for Part A and B, 1 card for your Medicare supplement, and 1 card for your Part D. Now, the reason most people like this is because you pay your monthly premium and there's very little out of pocket for every doctor's visit and test being run. But it is a fairly sizable amount every single month. This is why the or option 2 comes into play. Option 2, this is your Medicare Advantage plans, also known as Part C. This is a 1-card system. You still have to pay the government for A and B. There's no way around that. The government takes their money. However, with a Part C plan, these plans start lower than Medicare supplement plans. And because Medicare Advantage plans are owned and operated by private insurance, these plans typically have more customization and are built to suit your needs. By that I mean, Part C plans take A, B, and D, combine them all together, get rid of the deductibles and they use it on you pay a copay, you don't use it, your payment every month is a lot less. This is how that works. Now, some of you may have noticed the big plus sign down here. I'm not sure if you guys have noticed, but big business has basically bought up everything. They own all of the contracts. This is why this side has the big plus sign, because they own all the contracts with the dentists and the ophthalmologists and things like that. So Part C plans normally will come with dental, vision, and hearing included in the plan. Part C plans come with an over-the-counter benefit in most cases. In most cases, Part C plans are going to have a lot more extras and customization to fit your individual needs. This is the way that Medicare works. This is how you can literally customize it so that your plan and your spouse's plan can be two completely different plans, both from the same carrier. Now, there is, again, some right here, you can see some deductibles, some copays, 90 days, 150 days. That's your Part A. You had the skilled nursing and all of that up to 100 days. There you go there. You have your Part B deductibles and copays there. All right. And then, as I mentioned, Part C includes Part A, Part B, and Part D. It's a cost share and a premium variant. And then you have your Part Ds, which are your cost share. Same thing. So basically, the way you're looking at it, Medicare pays approximately 80%, insurer pays 20%. Exactly what I just said. So this is how it all lays out. That is Medicare in a nutshell. Now, as I mentioned, there is certain things that you can do that can make this a lot better. Now, I'm not sure how many of you have TRICARE for Life or even CHAMP VA. This is for your veterans who have either been hurt in the line of duty or served 20 years and then retired. If you have those programs, you have to get A and B anyways. And then you get your TRICARE or your CHAMP VA. What you don't know is that if you come down here, you could get a Part C plan specifically designed for veterans that could do a Part B give back and give you additional benefits, vision, dental, hearing, over the counter, things like that. So all of those would be given to you and you would save a little bit of money. Another way that you can make the Part B go down is if you are dual eligible. What that means is that you qualify for Mass Health and you qualify for Medicare. Now, the qualifications for Mass Health as of 2023 are really high. So don't think that you don't qualify, because as long as you make less than $2,308 a month, that's $2,308 a month, there is a good chance that you might qualify for dual eligibility, which means that you wouldn't have to pay for your Part B. Now, there is also many other things that go with this. When you sign up for Medicare, there's hospital indemnities, there's other programs out there that can complement your Medicare, but this is the main Medicare. Now, obviously, I can't go into extreme detail with each and every single one of you, so I'm going to end this the same way I always like to, and that is by inviting you all to schedule a one-on-one meeting with me where we can discuss in detail the complexity of Medicare and its impact on your life. Together, we can navigate this vital program, understanding its benefits and addressing any concerns or questions you may have. By participating in these meetings, you will gain an invaluable knowledge about your healthcare options. Don't miss out on this opportunity. Sign up today. Thank you for joining me for this meeting, and I hope to see you very soon.